majority of our patients, right? That's probably the biggest thing we see. But there's a number of things that can cause low back pain. And figuring out what it is that's causing that is quite difficult. Because it could be, arthritis, it could be muscle pain, it could be from a disc, it could be from a pinched nerve, and oftentimes the patients present with almost the same exact symptoms, yet it's a completely different problem. And then on the MRI, especially as we age, we're all going to have findings of, disc degeneration and arthritis, and so that might all be there on the MRI, and deciphering what is the pain problem can be quite tricky at times. Seeing if their symptoms match exactly what's on the MRI, but sometimes the MRIs are just so messy that it's hard to really decipher. How they describe their pain, the things that make their pain better or worse, the kind of descriptors of like shooting or burning or that type of pain. They're not exactly sure how to describe what this feels like. They just know that something doesn't feel right, but exactly how and when is hard for them sometimes. And so trying to get that information out of them can be a little tricky. And then, physical exam is a big one. We, run them through a number of maneuvers to try and stress certain parts of their low back to see if, yes, that is the cause of their pain. And then, if you take into account everything and then go with kind of like the most likely to least likely, that's typically how we do it. Between, medications that we try, therapy, or injections, sometimes you try what you think is the most likely and it doesn't work. And so now you got to move on to the next most likely thing that could be causing that pain.